My name is Jeff Saladay, and I came to Dr. Klingenstein a couple of years ago because I was starting to have hip pain on both sides. After getting an x-ray, we figured out that I had actually pretty advanced arthritis in my hips.
Jeff was a pretty unusual case. He came to me at the age of 43 with bone-and-bone arthritis of both hips. Here he was doing Ironman triathlons, and we had to come up with a surgical approach to meet his needs.
So I couldn't run, but also I was limping around the clinic. I have young kids. I had a hard time getting up from the floor. I remember if I would go miniature golfing with my kids would have to pick the ball out of the hole because I couldn't bend down far enough, and I was just in pain all the time. So there was no other viable option for me, and it was really affecting my day-to-day life.
So for him, I elected to use a SuperPath hip replacement. So for SuperPath, I don't actually have to dislocate the femoral head. So it's truly tissue preserving. So the goal is that it should feel more natural at the end of the operation. The other thing I did for Jeff, and really for all my patients for the last 6 years, is computer-assisted surgery. So I can plan out virtual surgery weeks beforehand. So the whole process is much more accurate than it used to be.
From being a physical therapist and seeing results of patients who are much older than me, how good their results were, I knew that at the tail end of this, I was going to be happy that I had the surgery done.
Not everybody is going to be running after a hip replacement. And the best predictor of activity is what were you doing before your surgery. So if you were very active before the operation, you can expect to get back there. I mean, at the end of the day, my goal is not getting back to running. My goal is to get him happy and functional.
I have the advantage of having some inside info because I see not just Dr. Klingenstein, but the whole joint replacement team. I see a bunch of their patients in the clinic. Their level of clinical expertise combined with the customer experience that I received as a patient, I'm sensitive to that because I try to deliver that with my business. Their ability to deliver a great patient experience was phenomenal as well, because that matters a lot to people.